as are necessary to develop, maintain, or restore to the maximum extent practicable the functioning of a disabled person. Now, where do we get confused in that?
And that is the piece where we need a treatment plan.
What
we need to do in order to establish a course of treatment, we need to have...
Case manager, 5, 6, 7 years ago, you should have hired a case manager and let them make a treatment plan. I've been trying to get you to do that. Listen to me. I've got 3, count them, 1, 2, 3 entities that have come to you over the last few years trying to be a case manager for my daughter. All 3 of them say that you discouraged them. One of them says that they felt threatened by you.
I'm sorry, Mr. Nesler, neither one of those 3 has ever come back.
You're willing to testify before Congress for what I'm saying.
They feel as though that we were not trying to accommodate. We've provided them information as to what it was that we needed and the reimbursement level that we would pay them at.
You find it at all odd, Lisa, that all 3 of them came to that same conclusion?
They have not voiced that to us.
They have written you letters about it. They've written to my congressman about it.
Unfortunately, I have not seen any of those letters.
Well, of course not. You didn't see it. There's a lot of letters that I've sent you that you don't acknowledge getting. What about the letter I just recently got from the central office that said, of course, your daughter should be receiving this care?
I don't think anybody doubts that maybe she needs to be receiving the care. Unfortunately, within the parameters of 1803 and health care, there are clear...
Stumbling block here. Where's the stumbling block? It defines health care. It says what it is, and that it includes habilitative and rehabilitative care. And then it defines what rehabilitative and habilitative care are.
Well, I think that, like I said, this past week in talking with Mary Beth Schneiderwin, I think that...
Lisa, tell me where in this there's a stumbling block to her getting this care. I'm a reasonable person. If you can come up with one, I'll look at it. Show me, read me in here where it says that she can't have this care.
Nowhere does it say that she cannot have the care that is cited in 1803.
I am my years in getting it for her.
However, what we do need, as Section 8 says, is...
Need a treatment plan for her to get habilitative care.
Right. And I think that...
Where does it say that, Lisa?
In order to determine the ability to provide services to develop, maintain, or restore...
Doctors saying she needs this care.
It is.
Letters which, incidentally, you've never been willing to acknowledge receiving.
The documentation that we received in second quarter of FY12, or I think it was March or April time frame, was basically a physician writing basically an overall generic need of services. It didn't say the duration. It did not...
You guys told my congressman's office that if her doctors wrote letters saying that she needed this care, that you would relent and give it to her.
In addition to that information, we explained what was needed, and that was...
Tell me where does it say, Lisa, that more is needed? Show me that. I want to see it. It's got to be black on white. You don't get to just make up rules.
The rules are not being made up, Mr.
And tell me where they're in black on white, ink on paper writing.
Well...
Do that, can you?
Well, this particular section of the law where it talks about habilitative and rehabilitative care, where it identifies...
Send it to me. Show it to me. I've got attorneys down here that'll be happy to look at it.
Okay, then maybe the conversation is probably more appropriate from an attorney to another attorney. That's probably the best. I mean, if that's...
It shouldn't take attorney. We're going to get this care for our daughter. It shouldn't take attorneys. But if it does, we'll get them. We're doing it. No matter what happens, Lisa, our daughter was intended by Congress to have this care. She's going to get it. And we will not pretend that we've been treated fairly in this years-long travail here of trying to obtain it.
When the law passed in 2008, it was explicit as far as what services would be provided. It extended the benefit from a birth defect and or the spina bifida condition itself to a more comprehensive level of care similar to what the CHAMP VA program offers, which is outpatient, inpatient, pharmacy, durable medical equipment beyond the spina bifida condition itself.
And habilitative and rehabilitative care.
And habilitative and rehabilitative care is medical health care services.
What do you mean it's medical health care services?
The services provided, the guidance services.
Where does it say that? It says in here.
It's under the Title 38 U.S.
Writing, it says that health care includes habilitative and rehabilitative care, and then it defines very clearly what habilitative and rehabilitative care are. You can't see that? You don't see where it says the term habilitative and rehabilitative care means such professional counseling and guidance services and treatment programs as are necessary to develop, maintain, or restore to the maximum extent practicable the functioning of a disabled person? You can't read that?
Mr. Nesler, I see what it says.
And why are you telling me it says something else? Is there some other document that covers this that is occult that I can't see?
I'm not saying that it says something else. What I'm saying is that in and of itself infers that
it only can provide skilled medical care. That's not true.
Services are needed in order to meet the maximum.
Counseling and guidance services. Let me ask you, is that a skilled medical care?
Guidance services is along the line of counseling guidance services.
Yeah, it's along the line of it. It's along the line of habilitative care, too. Listen to me, Lisa. You've made some bad mistakes here. Fix it, get my daughter the care, and I won't fight with you anymore. But if you try to lie to me and if you want to try to make me to pretend that bad things haven't been done to my daughter, I'm not going to go for it.
Well, I think, Mr. Nesler, you're mistaken as far as what my role here is. My role here is actually just to provide support to the organization of existing policies that we have, not to advance.
Your role with me, Lisa, was to be the gatekeeper to prevent me from getting my daughter in the door.
No, that's not accurate.
That's the deal. I mean, that's how it's going to be. My daughter is going to get the care, and if you fight and struggle and try to find, if you've got something black on white that says she can't get the care, or that says it has to be a real complicated process that we're not able to do, send me that. Send me in writing where it says that. Because I believe, layperson, but I believe that the whole damn set of rules is right here in 38 U.S. 1803.
Well, I'll follow up with Dawn Girac. Girac, I think that's what you mentioned her name was, who mentioned that there would be a case manager who would help assist in identifying the plan moving forward. And as well, I will continue to work with Mary Beth.
Mary Beth won't even return my phone calls. So how does that help me? Tell me some way that's helpful to me. Here's what I want. I want somebody to get on the telephone with me and say, you know what, Mr. Nesler, we're very sorry for what we've done to your daughter, and we're going to start tomorrow morning to make it right.
I believe that would be your legislators, Mr. Nesler.
Now, my legislators are the ones that passed the law to get this care.
The law that was passed...
All of my legislators.
The law that was passed extended the benefit beyond the spina bifida condition to provide for services beyond spina bifida.
That has no bearing on what we're talking about, that it went beyond spina bifida. What we're talking about here is that the term health care is defined here. The term health care means home care, hospital care, nursing home care, outpatient care, preventive care, habilitative and rehabilitative care, case management, respite care. And that you're supposed to supply those things. It defines health care, it defines habilitative and rehabilitative care, and it says you're supposed to supply both of them. Is there someplace else that there's some rules in writing that I don't know about? Because there's no place in here where it says you can't provide this stuff. Quite the opposite. It says that you must provide it. You shall provide it.
Was that a question? I'm sorry.
I said, healthcare, and I am quoting from 38 U.S. 1803. The term healthcare means home care, hospital care, nursing home care, outpatient care, preventive care, habilitative and rehabilitative care, case management, and respite care. The term habilitative and rehabilitative care means such professional counseling and guidance services and treatment programs as are necessary to develop, maintain, or restore to the maximum extent practicable the functioning of a disabled person. Now, we're in there, does that say some kinds of habilitative care that you can supply and some kinds you can't? Does it do that, Lisa, in there someplace that I'm missing?
And to define the as are necessary to develop, maintain, or restore to the maximum extent practicable the functioning of a disabled person requires a treatment plan.
That's the goal you're supposed to be shooting at.
That's the next step, and that's what we're trying to obtain so that we can move to the next, whatever services are needed that we can cover under the existing authority of the Spina Bifida Health.
What existing authority? Now stop right there, Lisa, and tell me what existing authority is there? The only authority I know of is 38 U.S. 1803. Is there something else that I don't know about?
That's the existing 38 U.S.C. 1803 authority that therefore is regulated.
Ask for me, Lisa. I'm an old artillery sergeant that can hardly hear. You have to slow down. Is there something else in writing other than 38 U.S. 1803?
38 U.S.C. 1803 is the existing authority that I'm referring to.
And tell me where in there it says that there are some kinds of habilitative care and rehabilitative care that you can't furnish. Where am I missing that?
That's not what I said. What I said was...
You said that they can't supply it because it's not medical care. Nowhere in there does it say...
No, that is not what I'm saying, Mr. Nesler. What I'm saying is that habilitative care and rehabilitative care are...
It mentions care in here. It says health care. Not one place. Show me one place in there where it mentions medical care. Can you do that?
The title of the section is health care.
Every place that it mentions care, it mentions health care, not medical care.
And in order to determine what health care...
You guys have made a big mistake in thinking that you could deny this care because some of it was not medical care.
There's no fault in anything at this point. What we're requesting is a treatment plan.
Listen very closely to me, Lisa. Hire a case manager and there will be a treatment plan. I said that 5 or 6 years ago. I'm saying it again today. How do you get a treatment plan without a case manager?
And that's the path that Mary Beth Snyder and I are working on at this point.
It won't even return my call.